Okay. Um, where to start? Where to start? I will introduce the panel shortly, but just give a brief introduction to start with. So my name is Dustin Barter. I'm a senior research fellow with the Humanitarian Policy Group of ODI Global. Thank you all for coming for what is a very timely and critical discussion. It is impossible to talk in this webinar without considering the current severity of the crisis in Gaza and how much of a failing of humanitarian action that is, and political action, and the sheer scale of atrocities that are going on. This is really kind of heart-wrenching on a individual level, but also on such a global level. And yeah, our thoughts are with everybody who is grappling with that, but also encouraging everybody to take whatever action possible as we must bring such suffering in Gaza to an end as soon as possible. And also recognizing there are a lot of systemic justices in across much of the world, which we will be diving into some of those aspects later today. In some ways, the situation in Gaza is reflective or illustrative of the humanitarian system that is so geared towards being reactive, but very difficult or really struggles to be proactive and address humanitarian need before it arises and to address the drivers of crises, which can often be long-standing, decades long. Uh, that little preamble kind of flows into why we're having this discussion today. It's really formed from a lot of discussions ODI and HPG, the Humanitarian Policy Group, are having with a lot of different actors across the global south, the global north, with civil society actors, with INGOs, with UN agencies, with donors, and really recognizing there is an absolute rupture in the sector at the moment. I can reel off the stats, but close to 50% of funding has been sucked out of the system, and you're seeing health systems collapse, social services, food security, a lot of different challenges across a lot of different contexts amid escalating armed conflict and other violence in many different contexts. And in response to this, we are seeing what has become known as the humanitarian reset, kind of power forward, and a lot of concerns over how that is happening. A lot of decisions are being made at the very top behind closed doors and not much influence from across much of the global south. Similarly, we have the UN 80 reforms and a similarly kind of top-down exclusionary or perceived to be exclusionary processes. So the idea of today is really trying to flip the script and hear from a lot of actors working at the coalface or at the foreground of humanitarian response in Yemen, South Sudan, and Colombia. So there is also this kind of diverging discussion of where should the humanitarian sector head. There's a dominant narrative around getting back to basics, the push for efficiency, economizing, and then there are other calls for integrating humanitarian action with this broader need to address drivers of crises, advancing nexus or integrated programming, and kind of taking a more holistic view towards where the humanitarian sector should be heading. This is all happening in the past 6 months at an incredible pace and leaving us all kind of gasping and gasping for air and going through a lot of difficult moments in time and across a lot of different contexts. This is against a backdrop of the Grand Bargain, which is nearly 10 years old. We may have another World Humanitarian Summit next year. There have been moments for change and efforts to push for change, particularly around ensuring greater local and national leadership of humanitarian action. Yet a lot of this progress, a lot of this reform has really stagnated. Today, we are going to hear from three exceptional panelists speaking to different contexts of what they are grappling with and really trying to foreground their perspectives and what they want to see within humanitarian system reform. So I'm very happy to be joined by Khulud Al-Harashi, who is the Program Coordinator and Localization Specialist for the Yemen Family Care Association. We have Modi Enoza Imbaraza, who is the Chief Executive of the Young Women's Christian Association in South Sudan. And then we have Maritza Adriana Copete Hernandez, who is the project coordinator for Sahed. So we have three quite different contexts and three exceptional panelists that we look forward to hearing from. So we will be having some interventions from the panelists first, followed by some discussion, and then we will put it out to extensive Q&A with the audience. So please stay tuned, and we look forward to engaging in plenty of discussion towards the end. So I'll leave it there, and please put your questions into the chat anytime, and our colleagues will filter them through. So first off, and we're going in no particular order, but from east to west. So Khulud, please, I look forward to hearing your interventions. Thank you.
Thank you, Dustin. Thank you all. I mean, you did great in reviewing the topic as a start, and I am looking forward to Yemeni context in specific. My name is Khulud Al-Arashi. I am the program coordinator and localization specialist at YFCA, Yemen Family Care Association, a very association, established in 1976, which means that we've been through many scenarios, many contexts, facing struggles and developing our capacities through the challenges that we have been facing since that time. Thank you all. And if I may, I can give you an introduction for the situation in Yemen and how humanitarian aid is working. So Yemen has been suffering from protracted conflicts for more than a decade now. And with multiple fund channels reaching the country since then, the impact of those aids is not showing any sustainability through time due to this complicated context. Now, which by time caused frustration of many donors, of course, and caused facing a critical turning point in this humanitarian landscape. So with ongoing funds cutting now, many international donors are scaling down their presence, and several INGOs, the international organizations, have either closed or limited their operations, particularly in the northern areas of Yemen. Now, this is due to political sensitivities and concerns raised by donors about access constraints, governance, allegations related to terrorism or aid diversions even. And as a result, donors now are reconsidering or cutting direct engagement in certain regions in Yemen. So this shift, however, does not reduce the needs on the ground, especially the hard-to-reach communities. They are remaining in dire need for assistance. And to cope with this fund-cutting trend, it is the right moment for humanitarian reform, as I believe. Now, the international delivery mechanisms are no longer sustainable in Yemen for the current context for most of the international organizations. And now it is the time to shift power and resources directly to local actors. Now, enabling the direct leadership and responding to affected populations across both North and South. Now, I should loudly speak about the local actors' success in implementing emergency programs that adhere to sustainable development goals and ensure resilience of the affected communities. They have the experience, trust, and access to continue operating effectively, and they are already embedded with the communities and successfully navigating sensitive contexts. So, for proper utilizing for the remaining funds, if we may say, especially now that the funds are directed other areas that are most in need, it would be, it would be more than appropriate to start developing new frameworks. And if I may suggest, emergency and development donors should work harder, like in developing frameworks to respond to the needs in Yemen. So even an innovative programming, such as graduation approaches, which some calls twin tracking approaches, which requires multi-year funding, sorry. So for that, I strongly suggest bringing emergency and development donors and funds together under unified frameworks, sitting in round tables together with all active actors operating in Yemen. So those frameworks should be designed and created in the presence of the CSOs, the private sector, and the local authorities as well. Unfortunately, now, local voices are often overlooked in decision-making tables, leading to disconnect between funding decisions and community needs. And this should be reconsidered during the current funding cuts trend. And I have seen many examples of ready designed programs that enter the country, my country, without consulting the local actors and authorities. Although the donors would strictly request the co-creation of those programs, the local authorities find that they were excluded from the design phase and pushed to either accept the program as it is or lose the fund. So this is an example, a living example for what we are facing and being exclusive from the decision-making tables. Now, we do acknowledge the concerns donors may have with direct funding to local, implementers and actors in Yemen, especially when it comes to political fragility that we are facing and financial insecurity risks for liquidity, etc. But rather than letting those challenges stall progress, we need to innovate. So I have two suggestions to innovate and support direct funding. I have one that is short-term approach, I call it this way, which is one pragmatic solution of redefining the role of intermediaries, particularly the UN agencies and international organizations. Now, instead of acting as primary implementers, the international organizations can serve as contractors for financial and technical support, for example, providing oversights and strengthening the capacity of the local implementers, while allowing local organizations to lead program design and delivery. This model offers a balanced pathway, addressing donors' concerns while still advancing the localization agenda. And I must admit that some donors have proven the success of this example. They have even overachieved the grand bargain of direct funding percentages going to local actors. And the other solution that I am calling a long-term approach is advocacy for empowering systems for direct funding. Now, we must advocate as local partners, donors, even authorities for systems that enable direct funding to local implementers and non-profit organizations for more equitable partnership and localization fostering, of course. So ensuring that resources are allocated effectively to those who understand the context best. We need to create even dialogues with donors to reflect the realities on the ground in the shape of informed risk sharing and mitigation rather than power dynamics and operational issues, as we call it. Some of the Yemeni NGOs or local implementers worked really hard to strengthen their institutional structure to compete for direct funding and succeeded even in receiving direct funding. However, not all donors are open for such approach. And I would really like from this stage to hear more examples of successful stories achieving direct funding from donors and local actors. So these are my perspective. I'm trying to convey the messages from the Yemeni actors under humanitarian aid provision. Thank you, Dustin. Over.
Thank you. That was excellent intervention to get the ball rolling. And yes, I think you highlight a common issue that there are many good examples of positive and constructive practice, but then how do we turn oases or islands of good practice into these more systemic shifts that we all want to see in the humanitarian sector? I will hand it straight over to Modi to kind of contribute and build on what Khulud has already mentioned, but bringing in the perspective from South Sudan. So Modi, I hand it over to you. And for the audience, that we are having connectivity issues. So if there's no video, we apologize, but hopefully we should have video for most speakers. Thank you.
Thank you, Dustin. My name is Modi Enosambaraza. I'm the Executive Director for Young Women Christian Association South Sudan. I'm briefly talking about the context of South Sudan. South Sudan got independent in 2011. Just after 2 years, in 2013, the country entered into crisis, which of course have led so many South Sudanese to flee the country and then increase the complex humanitarian crisis caused by insecurity, tribal conflict, and cattle raiding, climate factors like flooding, heat wave, inflation of South Sudan currency has increased the humanitarian demand in the country. In the current situation, we are saying that South Sudan is yet in the middle of the crisis that requires humanitarian intervention. Support, according to IOM tracking, over 1.9 million are internal displaced in South Sudan, and they're hosting over 1.2 million refugees, mainly from Sudan, Central African Republic, and the DRC. The effect climate change in some parts of the country where floods swept everything and leaving the community vulnerable without food and the basic requirement to survive on. The most affected group are the women and children with increased diseases, maternal mortality rate, inadequate food, which leads to malnutrition, poor health, and the facility and the services. Inflation of local currency against the international currencies, which leads to increase of price in the market that most vulnerable people, like women, persons with disability, elderly people cannot afford. When we look at the current situation of fund cutting, the donor who are supporting humanitarian intervention has made it worsen in less than 4 months. International organizations supporting humanitarian services are closing down in South Sudan. There is increased number of unemployment among national, international staff. Service delivery gradually declining. There is donor fatigue due to the crisis that we all understand. As a result, there's need to identify local initiative that can respond to local needs when crises arise. Coming to our situation as national actors, local actors have the ability actually to respond immediately to crisis when it happens. They have the ability to reach hard to reach destinations or the areas, the community. However, we have been limited access to funding. We also are not involved in the decision-making level where funds are being allocated. So we do not have a decision on whatever. We don't hear anything about funding or something of that kind, but the service that we are delivering to community is effective given the little sources that we are having. Secondly, the local actors do not have direct connection to the donors. They always go through either intermediaries like international organization, which makes it hard for them to deliver effective services with a small amount that is allocated to them. Local humanitarian actor should be given opportunity to at least lead in responding to crisis that affects their community in needs to focus greatly on local lead initiative and allocated reasonable funds to local actors for humanitarian intervention. When we look at some of the funding opportunity within the country, there's a lack of involvement in the ongoing humanitarian reset. The humanitarian reset currently being led by OCHA at the country level has progressively rapid without any meaningful involvement or consultation of local actors or national actors. Primarily, documentation indicates that these actors have largely been left out of the process. This exclude this exclude the risk wasn't the situation, especially in the context of ongoing aid cut. So some of the decision that is being made has as a local actors are not being involved in, especially in the humanitarian reset. So what we are looking for is like how can the local actors who are actually going to hard to reach location be involved in the decision making part? So we are recommending that at least involvement of local actors in the decision making table where major decisions on funding are taken. Secondly, we are looking at how can we be able to make these local actors effectively. We need to train and strengthen the local initiative, like the community-based organization at the grassroots level, the national NGOs, and the faith-based organization, so that they can take lead in humanitarian affairs. Thirdly, we require allocation of a bigger funding to local humanitarian actors so that we can address, because they live directly with the community. When something happens, we can take a responsibility immediately, and then now we can send the report to other international actors so that they can come and support us, as we have already taken lead and we have saved life. So there's need to allocate bigger funding for us. And then also we need to mobilize and use local resources to respond to humanitarian crisis. We have resources locally that we can mobilize and make sure that we use it as we are waiting for other people and well wishers who can come and intervene and support when there's a humanitarian crisis. Basically, this is what I said I can share with you. Thank you.
Thank you, Modi. Yeah, lots of excellent points there. And I really liked your emphasis on how a lot of local and national actors across different contexts are often working in the most difficult to reach areas, the most dangerous and insecure locations, but also this need to invest beforehand to kind of enable and enhance that flexible, dynamic levels of response. So the funding crisis may be new, but the opportunity to invest in local and national actors is long-standing, and it can't just be expecting all of a sudden local and national actors have to do everything. There has to be strategic long-term support for that to be as best as possible. So thank you for those interventions. I'll now hand over to Maritza. And apologies, I see there's some questions about the camera, and we are getting that sorted. Thank you. Maritza, over to you.
Bueno, gracias a todos y todas.
Thank you, everyone.
Buenos días, buenas tardes.
Good morning, good afternoon.
Por permitirnos compartir la
Thank you for
experiencia de
allowing us to
Colombia,
share our
un
experiences
país
from
del sur
Colombia.
global,
Colombia
profundamente
is a country in the
afectado por
global
múltiples
south. It's been
crisis,
affected
pero
by
también rico
many
en
crises,
propuestas desde
but it
lo
also has
local.
a very
Hoy vengo a hablarles del
important
Grupo Nacional
proposals
de
at a local
Referencia,
level. So I'm
una
going to talk to you
iniciativa
about
que
a
nace como
reference group, a
respuesta a un
benchmark group,
sistema humanitario
about an initiative
que, aunque
that
dice estar
began as a
comprometido con
response
la
to a
localización,
humanitarian
sigue siendo
crisis. And
centralizado
even
y
though it is
vertical.
localized, it is centralized and it
El
is
Grupo
vertical.
Nacional de Referencia
So this group
surge desde la red NIAR en alianza con
began
Oxfam
as
Colombia
an alliance with
y
Oxfam
organizaciones como
in
Jalud,
Colombia and
Sahed,
organizations as
Corpo
Halud,
Caminar,
Sahed, Corpo Caminar,
y se constituye como un espacio
and it was made up as a multi-agent
localmente,
space, a horizontal
con el
space,
objetivo de
and
monitorear,
led
coordinar
locally.
y conectar los
Its objective is
compromisos
to
del Gran
connect
Pacto
commitments
con la realidad
from the
operativa de
Great
Colombia.
Bargain with
Entonces, ¿por
Colombia.
qué es urgente la
So why
transformación?
is it
¿Por qué es
important
urgente transformar?
to accomplish transformation?
Colombia enfrenta una crisis
Well, Colombia is
humanitaria
undergoing a
compleja,
humanitarian
marcada por
crisis, a very complex
violencias
crisis.
persistentes
It's been
de
marked
conflicto
by
armado,
violence, by
con
armed conflict,
desplazamiento forzado,
by forced
hacinamientos,
displacement, confinement,
asesinatos de líderes locales,
the killing of local leaders.
por brechas estructurales en
There
salud,
are structural gaps in health,
educación y
in
empleo,
education,
especialmente en
and
regiones
in
como el Chocó,
employment,
la
especially in
Guajira,
regions such as
el
Chocó,
Catatumbo y la
Guajira,
Amazonía,
Catatumbo,
entre
and
otros,
the Amazon.
por la presencia de actores armados
There
ilegales
is a presence
y
of
economías
illegal armed
ilícitas.
agents,
Mientras el
illegal
Estado aún no
economies,
logra integrar plenamente
and
el
the state
territorio
has
y
not been
garantizar
able
sus
to
funciones
integrate the
básicas.
entire territory
Todo
or to
esto en un
guarantee
país
its
con enorme diversidad
local
étnica
efforts. However, Colombia is an ethnically varied space, so a single solution isn't possible. However, we need to have a first line of defense, a first line of action, and this first line doesn't have direct financing. It doesn't have the power of deciding for itself. So this has an impact in its limitation. The experience of the group that I work with has demonstrated that there is a different way of coordinating efforts, and it's possible to do this. So I want to share 3 examples with you. In 5 regions of the country, local organizations lead dialogue with governments and with international agencies. This is a symbolic participation. It's leadership. It's real operational leadership. We have 3 frameworks that represent participation in each region. We follow up with our commitments, and we have a differential approach. So from this group, we project an open call for different voices so that we can reach Geneva even. Territories are now the ones making these calls. So why is it important? What is the role that donors play? Well, when a donor is sitting at the same table with the grassroots organization, its role is validated. It's listening without intermediaries, and it creates solutions together. This is what my group allows. It's not a project, it's a transformation process. And we have to keep in mind certain aspects regarding power and structural change. So humanitarian power is not redistributed with discourse, but with decisions. Is this system going to hand over power to the people in the territory? That's a big question. International agents are talking about localization, but what about design? What about execution? That is still in the hands of the North. And something else about local legitimacy. Local organizations not only have operational capacity, but they also have knowledge. They know the contextual knowledge, and they have a very deep knowledge. So why is this knowledge not considered strategic? We not only respond to crises, but we think about systematized solutions, we think about learning, and we build alternatives. And what about shared risk? When there are evacuations, the international groups just leave, but we have to stay. So we assume the big risks in prolonged crises. So we need to focus on this co-responsibility in the face of risks. Finally, regarding sustainability, the humanitarian system has offered millions in response, but not in autonomy. So how is change going to happen without strengthening local? We don't want to just deal with fires. We want to prevent them through resilience. So thank you for this space. And this should not just become a report. It should be a commitment with the voices of the South. Thank you.
Thank you, Maritza, for that excellent intervention. I think it's also very interesting just considering Colombia as a middle-income country, yet also dealing with a lot of violent conflict and turbulence. I loved some of the points you made there around the gatekeeping of information, and I think this is so critical in terms of who is speaking to who, what decisions are being made on what kind of information, and how do we connect, global decisions, national decisions, regional and subnational with different actors and ensure we're all making informed decisions. I always kind of go back to this seminal text by Robert Chambers about whose reality counts, and it called for, a listening to communities approach and listening to people who are heavily and directly involved in crises. And that was now 30 years old, that text, yet we still struggle to get our heads around and act on this kind of process. And I think I liked that your mention of co-responsibility and this kind of issue when you have a lot of international actors evacuating areas, and it's often local and national actors who are left behind. And we saw this whether it's armed conflict or in COVID, yet we still tend to invest far more in the international system rather than the more resilient and dynamic local and national systems. So thank you for those initial interventions. I want to open the floor back to the panelists to see if, now that you've heard from each other, if you had any further interventions or reflections that you would like to add, and then we can kind of hand over to opening it up to the floor as well. So I don't know if Hulud or Modi, you wanted to jump in? Yes, and if possible, please turn on your video. Just I appreciate connectivity is difficult, but yes, thank you.
Thank you, Dustin. I would really appreciate, the efforts done by Modi and Marteza. It is amazing to see that we are in the same dilemma. We're facing the same issues. We are trying to deliver our voices wherever possible. That we have, access to donors, maybe participating in events. This is good for local partners to do their role and deliver the community's voices, and work harder to, ensure a proper response mechanism that involves all actors on the ground. So I am really amazed by the efforts done, let's say, in Colombia and in Sudan in relation to this. And I would like to emphasize one of the points that I mentioned by Modi in Sudan, which is the community-based organization support. This is really something that we look forward to. This is really something we need donors to help us make it as a requirement that, national organizations should implement their programs through those community-based organizations. Even, they are grassrooted. However, we are obliged to support them to ensure their sustainability for more resilience for the communities. The crisis is never ending. It is everywhere. Either it's a climate change issues or internal displacements due to wars and etc. So, and we are recognizing that the funds are cutting now, and the funds are reducing now to Yemen channels, to Sudan, to etc. because of going to other countries. However, we still need to collaborate together for more informed systems. As they already mentioned, something related to risk sharing, which I truly encourage. It is currently my number one role in the humanitarian system transformation, the local humanitarian leadership funded by Oxfam and the donors you have mentioned, and in the webinar, event and the event title. Basically, we are focusing in more re-informed risk sharing for better response to communities. So this would help us grab the donors to sit in the same tables. Participate and feeling for the local implementing partners, the communities, etc., through simulation workshops to discuss, to learn more how to look at those challenges, not only thinking of operational issues hindering from implementing, etc. It's causing delays in delivering the assistance, which is reflecting the incapacity of the local implementers. This is not the way it is. They need to see further, they need to understand, they need to support us. It's their role to help us evolve and be empowered, especially to the local communities. So thank you to them all. And I'm impressed about the Colombia experiences. And I do support her mentioning something related to let's say, forums that is directly leading the decisions and try to reform the decisions. This is something we really look forward to have it in Yemen as well. And we are doing our efforts as well. And I'm sure that my colleagues in Yemen have established the the NGOs forums, to deliver the voices, to be part of the coordination systems in Yemen, which I should highlight this point. Coordination is the key. So coordination is the key, yes, but it's not supposed to be within the closed doors. So when we say coordination, it means that you involve all the active partners, either community-based organizations, local authorities, private sector, etc. So we need all to be in the same table, everyone learn about his role in the community and the tasks, assigned to them. We should implement in a unified work frame manner. We should for more transparency and accountability to the affected communities. So this is how I see it. Coordination means open doors, not closed doors and closed tables. Thank you. Over.
Thanks, Khulud. Maybe I'll open that up to others as well about this coordination factor, because that is a big part of the proposed humanitarian reset and reforms. I know from Myanmar, as one example, there is representation of local and national actors on the humanitarian country team, which sounds good, but then you have the Myanmar Red Cross, which is aligned with the junta, and all of a sudden nobody wants to speak openly about things in the humanitarian country team. So I think there are a lot of nuances in how do we open up these spaces of coordination, how do we involve local and national actors, how do we make that a safe space for equitable coordination. But Maritza, I'll hand over to you as I see your hand up. Thank you.
Sí, entonces quisiera también pues, que a veces
Yes.
nos hagamos algunas preguntas.
Sometimes we should ask some questions. What is more transformating, delivering funds or sharing decisions? Because real localization implies giving in strategic spaces and not only resources. And also, how do we make sure that the local voices are heard of and taken into account in the global design? Well, by creating formal mechanisms like the reference national groups, where feedback is systematic and has a political weight, and by connecting these mechanisms with global governance, and so on. We could also ask other questions. Current coordination models, do they allow the real participation of local agents? Not many times. They are vertical spaces. Many times they are closed, like Claude said, and they should be reformed in order to re-include community-based leaderships in an equitable manner. And finally, what's the role of donors in this transformation, which is also worth asking? And they should also not only fund, but also accompany, hear us, be accountable in order to open up the system to new governance forms that are more equitable. So perhaps we could learn from the reference national models we have in Colombia to replicate that experience in South Sudan or Yemen. And we could also adopt a more flexible structure, multi-stakeholder dialogue, ethnic and territorial inclusion. Well, all of this should be taken into account in order to have that transformation. Thank you very much indeed.
Thank you, Maritza. We're already getting quite a few questions in the chat box. So to those in the audience, please throw your questions out and I will share them anonymously, so speak bluntly. But maybe, Modi, I'll hand you a question from the audience already, which is, in your experience, how have recipients of aid perceived or talked about international humanitarian efforts in South Sudan? Do you believe there are spaces where people can voice their honest opinions in the South Sudan context? Thank you, Modi.
I'm sorry, my recording I've just changed to I don't know how to change it back.
That's fine. We can see you and hear you. No, all good.
Oh my God. Can you hear me, Dustin? I cannot read.
We can hear you. Please go forward with the answer.
Oh,
Do you want me to repeat the question?
yeah.
Sure. So the question was, how have recipients of aid perceived or talked about international humanitarian efforts in South Sudan? Do you believe there are spaces where people can voice their honest opinions about the aid system?
Basically, we have international organizations who support the localization. However, it's not all. Some of the international organizations who support the localization. As such, maybe through this this international actors, we can air out our voices. For instance, like Oxfam, who are supporting the localization, and the C4C, including the grand bargain. The representative in country we can be able to air our voices there. Secondly, also, we need to have access how we can really present our cases directly to the donors. If we are implementing the program directly with the beneficiaries, and the part of it we are the beneficiaries, we can be able to present our issues to the donors the raw way, how it is. And then it will be actually, if service is being delivered, it goes exactly like how the community wanted. We need to be engaged in the final decision making because we know the situation in which we are. We know the local context in which we are living. I don't know whether I answered the question because previously I was not listening correctly to the question.
No, that's great, Modi. Can I maybe ask a follow-up question also from the audience to kind of keep you on your flow? So there have been many years of so-called efforts around localization in South Sudan, often overlapping initiatives with many meetings in Juba, policy and research papers, and commitments across the board. Why have these efforts not achieved more significant progress, and what lessons can be learned from this for South Sudan and globally? If you have any reflections on that, Modi.
For me, I am really concerned because most of the local actors, they do most of the things or most of the activities directly with the community. And then some of the things that is being discussed, sometimes we do not get involved. Like I said earlier, we are not more involved in the discussion. Some of us as actors, local actors, we just get the things ready. Like for instance, call for proposal. The donors say we need to run this program in this location and not this location. Some of these discussions we are not part of it, but because we need to deliver service to our community, we just find ourselves now adhering to the requirement of the donors or international partners. So what I'm looking at is like if there could be possibility for engaging local partners, at least in some of the program that is there, inquiring about what what are the requirements from the community, what is their needs. Then the community come up with their needs, and then the local partners present it to the international partners and the donors. At least from there, the local partners will be engaged, at least part of the decision making.
Thanks, Modi. Yeah, I think you described the humanitarian hamster wheel, let's say, where it's just this constant cycle of here, do this, and the subcontracting nature of relationships between international and local and national actors. So that's some excellent explanations. I've got a question for Khloud, but we could maybe open it to everybody. But there's agreement that funding should go to local actors. Are the country-based pooled funds, I think we're assuming the OCHA country-based pooled funds, is that not sufficient, or is that not allowing for funding to local and national actors? Thank you, Khloud.
Well, actually, I mean, the YHF program in Yemen is doing great in communicating and reaching to, delivering those funds to local implementers. So basically, OCHA is doing its best to support localization. It is seen. But what we are looking for is more than that. So basically, OCHA program, it's an emergency program. And emergency means that you have to implement it in a very short period of time, which is not more than, let's say, 10 months to 1 year maximum. So basically, I think the need in Yemen is far beyond having short-term programs. Although YHF programs have proven to have adhering to sustainable development goals and do sustainable projects for the communities, rehabilitating, communal assets for agriculture, if I may say, and water resources, etc. However, we are still in need to emerge those efforts and funds to change the perspective of donors to collaborate together. It's always annoying to just being in a table and speaking to one donor that have two offices, for example. One is specific for emergency and the other is specific to development, and they don't look forward to have collaboration approach. It's just that when you go directly to one of them, I am for this 1, 2, 3 fund, you should directly, engage with me. Otherwise, go and discuss this with the other department. How can we, improve our response to the community in needs if we are going to implement this way? And we all know that development interventions and funds directing is reflecting different, let's say, means of verification, like the reports that they are depending on. For example, for the emergency responses, they do have the response, the HNRP, which is developed by the, certain entities in the country. And basically, we have been fighting to have a role, to be part of this process. So nowadays we have reached the level of being part of those tables, but with certain limitation. We only have, the ability to participate in the localization part, but we're not able to participate in the needs and gaps of each sector. Although we are involved in each sector, for example, as local partners, we do have the capacity. And when it comes to, delivering our voices that we need to be involved with the authorities, it turns to be a surface relationship. They would invite you to, let's say a workshop just to endorse what they have already been planning and distributed in terms of frameworks, etc. So basically, we need to, improve the way that we are supporting localization from all perspectives of donors, local actors, local authorities. And I know it's difficult with the context of Yemen with this, political fragility. However, I do believe that we have a role to play and we can do it all together, not separately efforts. Thank you, Ova.
Thanks, Claude. And yeah, you mentioned this kind of connectivity and the arbitrary distinction or siloing of aid flows. And I think it's worth recognizing that over 90% of crises are protracted, particularly if we look at Yemen, Colombia, South Sudan. We're not talking about sudden onset. Maybe there are high variances, but these are ongoing long-term crises. So there is another question here related, and I'll maybe throw this to Maritza, but to everybody. For all the speakers, it has been mentioned that OCHA is leading the humanitarian reset conversations. From your perspectives, how concerning is this for the different speakers? Is a UN-led reform going to be effective in South Sudan, Yemen, and Colombia? So please, any of you jump in, but Maritza, maybe you want to go first. Thank you.
Okay. A ver, yo diría que es una buena pregunta.
It's a good question. From our experience in Colombia, we are concerned that the leadership of OCHA in discussions can replicate the same centralization and verticalization patterns that we're trying to transform. So a reform led by UN organizations risks keeping decision-making far away from territories and from the organizations that are facing humanitarian crises and humanitarian challenges. And this is the same for Colombia or for Sudan or South Sudan or for Yemen. because we need a reform where we can not only listen to local agents, but have them as the protagonists. If the United Nations wants to lead, they must open the way to a shared leadership with networks, with local leaders can participate in a sphere of equality. And if power isn't transferred, if financing isn't transferred, then the reform will not be effective. So I would say that the call is to decentralize the conversation, to democratize this conversation, and to make it local. This is the only way of making it legitimate and sustainable.
Thank you, Maritza. Modi, I saw you unmuted, and then I'll hand over to...
Yeah.
Thanks.
Yeah, the UN OCHA, basically in South Sudan, I'm talking in context of South Sudan, most of the funding that is there, for instance, SSHF, even if you apply as a local partner or national NGO, you might not be considered. It's always international partners who are considered in that. With the excuse that most of the time they say the local partners have no capacity. And then there's no proper capacity assessment that has been done to the local partners to know whether they can run this volume of funds or not. And then as a result, they allocate to the international partners who may decide either to work together with the local partners or not. So what I'm thinking is like this UN system can also engage and support the local or national partners in order to how they can be able to access such kind of funding, like any other international organization as well. Because if it is like, for instance, the South Sudan Humanitarian Fund, if it is going most of the time to the international partners, and then we as the local partners or the national partners, we are not accessing it, then the service that we are going to deliver, because like I said, we reach the hard to reach locations, then it will be very complicated for us to reach. So they need to be a little bit flexible with the national organization and make sure that they have also to look at the capacity, do the capacity assessment. If there's gaps they identify, then they can strengthen those gaps and then make the local and national organization take lead in delivering service to the community.
Thanks, Modi. Claude, I saw you with your hand up before if you wanted to jump in. Thanks.
Yes, I would comment on Modi's comment. I mean, yes, OCHA in a certain time believe that the capacity of the local partners needs to be improved, and actually approved having budget lines for capacity building programs within the emergency funds. And then of the sudden, when the funds were cut, they decided to remove that budget line. So basically, it was part of their role to build the capacity of the local implementers to ensure, that the funds are going in a safe environment to be implemented properly. But still, they are hesitating their role in capacity building, provision to local implementing partners. And mainly to Marteza's point, she mentioned something related to decentralization. So the Yemeni scenario is basically, as I mentioned, north and south, and it's always annoying the southern communities with the centralization done in the south. I mean, in the north. So basically, decisions are made there, and with no access for southern representatives within those decisions made for funding, direction, etc., etc. So there is always a mess and a big fight between funds going to the southern and northern areas, and there has been it has been complicated since like for almost, let's say, 4 years when prioritizing the most communities in need. If they are in the northern and in the southern, who make that decision, and why it's not with open doors, as we already illustrated too. Thank you.
Thanks, Lud. So we've got quite a few questions coming in, which is excellent. I might go to one which is out to everybody, and we've maybe focused a bit on OCHA and the country-based pooled funds. So this one is looking a bit more around INGOs. So if we look at the current system reforms, which are driven much more by budget cuts rather than a genuine transformative vision, how do you perceive INGOs that are interpreting this shift of power when they move their headquarters or offices to the global south? Because from the questioner's perspective, rather than promoting true power transfer, this trend often results in a strategic readjustment that can crowd out local civil society organizations. What is your take on this shift of INGOs into much of the global south in terms of decentering? Any reflections there? Modi.
Maybe, okay, can I come in? Yeah, what I'm saying is like we cannot omit like international organization completely from maybe coming to the global south for supporting, because we really need to work in collaboration in whatever we are doing. Also, when we work in collaboration, it's easy for us as national organizations to report any incident or humanitarian crisis that happen at a local level immediately to the international partners, and then they forward it to whoever is willing to intervene into that crisis. So we work in collaboration, but also putting into consideration that international organization should give a space also for the local partners to lead, for instance, in networks, in clusters, so that they can practice their leadership also there. So this is what I can mention.
Thanks, Modi. Maritza or Hlut, please jump in. Thank you.
Yes, and I think this point is emphasizing my suggestions I made at the beginning of the webinar, which is, to specify the role of the INGOs operating in any country of those, participating here in the webinar. So basically, they have a role to play, and we do believe in its strength. The same way that we are believing in our strength as local partners. So each one has its own strength points and weaknesses, and I think it would be good to, reshape those roles worldwide, let's say globally, and understand where to put who and when and how they can support localization through those roles and decisions. Thank you.
Thanks. Maritza, I see you coming in. Thank you.
Por eso en algún momento decíamos que era importante.
Yes, at one point, we said that it was important to think about the coordination models that are being created. Currently, there is no real coordination, no real participation of the actors in specific areas or in specific territories. So these spaces have to be modified. They have to be more horizontal and not vertical. This will allow for including community leadership in an equal way. So with this real transformation of participation, of joint responsibility, I think that there will be a change in the way of generating power. Because we have to think of power, of how power is being created and how power is shaping the transformation. Is power changing? Is power being modified? This way, things can be different. However, if we just change the name, whether it's called humanitarian reset or something else, if we just maintain the same structure, then we're not going anywhere. We have to change the way we think about this coordination, about how we complement each other.
Maritza, that was excellent. Yes, I think we can't just end up going through a whole reform, reset, transformation process and end up with the same problematic structures. There's maybe a follow-on question that is related. So I'd say in some ways there is this idea of local and localization that often gets kind of very flattened out to not capture the diversity amongst local actors. So we have this question of how important are the voices of program participants and communities, particularly refugees, displaced people, LGBT plus, in decision-making and the efforts to shift power? And how could we better include them in the processes across these different contexts? So that was for you, Maritza, but I think is open to everyone of how do we ensure that kind of inclusion of different perspectives. Thank you. Maritza, if you wanted to go, otherwise anybody else feel free to jump in.
Okay. Yeah, the engagement of different people, for instance, the refugees, the internal displaced persons, and then special vulnerable groups or the minority groups also is a key in whatever we are doing as national actors. So, some of these people are being neglected most of the time, especially in our context in South Sudan, the LGBTQ plus. They are not actually openly. However, the issue is like some of these people are not, their voices are not considered. And then internal displaced persons also, we really need to give them support because they fled from their own areas coming here as well as the refugees. So what we need is like, for instance, we were working with the refugees from Sudan. What we need is to engage them in some of our activities also, and then special areas of maybe activities such as trauma healing and counseling and other activity that pertain them. So us as local partners, we are willing to work with this category of people and engage them in our programming as well.
Thanks, Modi. Claude, I saw you had your hand up as well, if you wanted to jump in.
Thank you. Yeah, actually, we are the people meant to deal with those, categories of the community. And we basically implement our emergency programs or even, long-term assistance for those communities. We basically, let's say, create community committees and orient them about the way we operate, the criteria for selection, those and need and prioritizing them. So this is basically the way that we work as local partners. We engage the communities through creation of community committees representing those categories, like marginalized, IDPs, lactating women, etc., from those vulnerable communities. So it is also our role to deliver their voices where possible. So yes, we do have this obligation, we do have this role that we, through the need assessments that we conduct from while to another, and during deciding the area of intervention within the local authority. So it's basically a roundtable discussion with different actors in the community, finalized by final decision where to put the assistance in need. So this is how we implement our YCHAP programs and many other donors, unlike some of the other donors that do not appreciate this way of implementation, and they do design their own programs and then just give it to you as it is and request you to implement. So yes, basically we have a role to represent their voices and put them in the round tables that they can't reach to. Thank you.
Thanks, Lud. And I liked also before we launched this webinar that speaking with all three panelists, each panelist went back to different civil society actors to consult and get different ideas to ensure they're representing quite a few different views, just even for this 90-minute panel, which I thought was really excellent to see. And I think we talk about obligations and obligation for consultation, obligations to create space, to have the dialogue, have the discourse, but also ensure that consultation isn't just tokenistic, but also leads to informing and changing our decisions to be more collaborative and inclusive is really, really important. I'm just going to go to this next question, which I think is an excellent one and speaks to what a lot of the panelists have been discussing. So considering so many crises are protracted, do you think we need a new humanitarian system which does not separate humanitarian from development and which includes local and national governments, private sector, and other stakeholders that are largely excluded from the current internationally dominated humanitarian system? Maritza, maybe we hear from you first, and then we can jump over to the others. Thank you.
De hecho, el Grupo Nacional
As
de
a matter
Referencia,
of fact, the Reference National Group is an initiative that takes into account all these actors, the private sector, the public sector, the academia, the grassroots local organizations, the international organizations, the UN system. This Reference National Group is a multi-stakeholder group where all different actors or agents participate. And they should reflect the context of what is happening in their different regions. In Colombia, we have many regions. Some are more vulnerable than others. And everything has to be centered in the context, in the culture, in the different ethnic groups, in the different approaches we have in our country. And each one of these agents plays a key role. For instance, the academia. The academia allows us to have evidence, to have research-based findings, to be an independent agent that will be collecting non-biased information. So they allow us to be informed and be at the same time in a continuous process of updating of events. So each agent, each actor has a key role to play, and they are all equally important. And then we will be like a link. We are speaking about the humanitarian aspects, development, and peace at the same time. And those are three lines of action. We are based on these three-factor initiative, and they all go together. Thank you.
Thanks, Maritza. Modi or Hlud, would you like to jump in on the question about? Yes, Modi.
Regarding the involvement of different sectors or actors to humanitarian service, we are neglecting some of the people who could contribute greatly to the intervention on humanitarian service. For instance, like the local companies, even the government itself, they have to intervene because they are the people. This is the people that they are serving. The government need to allocate something that can support humanitarian intervention. And then also like the business community, sometimes we are neglecting them. And then secondly, you mentioned something about if you can concentrate only on humanitarian service or we can mix it with development, which of course I concur with you that we really need to mix. We don't need to only focus on service delivery. The people that we are delivering service to, we need to empower them also so that they can take their own, they can stand of their own and do something for themselves. For instance, if we can engage community, like for instance, displaced persons, if we can engage them in economic empowerment program, so that they can start small businesses that can generate daily income for them. Because with the current cut of fund, it will be difficult for them for the daily service like food that is being distributed to them. If something is given to them like training on economic empowerment so that they can start business and then start up something that can generate income for them, it will yield a good result than keeping only giving like food material to them and then also giving them like everything. We need to at least merge from that area to where there's combination of development and then humanitarian service delivery. We need to mix the thing all together. Thank you.
Thanks, Modi. Claude, I feel you have lots to say on this point as well. Thanks.
No, I couldn't agree more. I mean, my colleagues are shy to mention the dependency level that the community have reached to of long-term, I mean, funding period of time with emergency assistance delivering with short, I mean, smaller scale focus on the more sustainable programs. As Modi already mentioned, that we need to focus on the empowerment of the communities, the income generating activities that we can support by, rather than just giving, food kit that will end the next month, for example. So basically, the communities are, suffering from dependency. And that means that we have a lot of work to do on smaller scale and larger scale. So in smaller scale, we need to, duplicate our efforts in more sensitization and, orientation for the communities, the importance of longer term impacts within this funding cuts trends, and the importance to continue and stop fighting for just emergency assistance that lasts at least, maximally 6 months only. So I think this is the smaller scale, and then the larger scale is donors to help. And this is where I mentioned that, emergency funds channels within the development channels, and private sector representatives with humanitarian aid representatives in the country should work together collaboratively and to complement each other through, designing a well-prepared program that supports the community for longer term. And I think some of the donors funding Yemen is the FCDO. And I should really mention this example because it is running now a program that is a 4-year program. And it's like a graduation approach. Something is new for cluster. Even clusters are just advocating for it, but they don't have like a certain guidelines, certain tools to use within the implementation period. However, it is still a success. The FCDO is approaching through an alliance, a consortium, basically delivering assistance, emergency assistance, then let's say assessing the food security level of the communities, then moving them to more income generating activities for more sustainability, et cetera, until they graduate from the emergency level to more resilience. So this is an innovative approach. It's still new in Yemen. I'm not sure if it's implemented in Sudan or Myanmar or other areas. However, I feel proud to be part of it as a local partner in a leading position. And we are implementing and receiving the funds, not just, I cannot say directly, however, it is a shade better than the others because there is an intermediate, of course, to deliver the funds to the local partners, which is YFCA. So, and within this approach, the FCDO have experienced only funding one local partners 5 years ago, and it was YFCA. However, in this consortium, it is, FCDO is funding around 7 local implementing partners, which is, a progress in localization support. And it's establishing its own localization strategy to support the partners, the local partners, the communities, etc. And I just felt like I have to mention this example just to elaborate more on the innovative ideas that help us move from emergency to more resilient and development coverage for the needs within a certain area. Thank you.
Thanks, Claude. Following on from those questions, I'll maybe throw to the next one, and just to mention that HPG, the Humanitarian Policy Group, is doing a whole body of research around state-led humanitarian response. And a lot of these discussions, we are very focused on shifting power and resources from international humanitarian actors to local and national civil society. But there are big questions about the state. What is the role of the state? How can the state be crowded into a system that is very dominated by international actors? And I'll give one plug for a piece of research that was just published, looking at Indonesia as quite a positive example of a nationally led disaster governance. So my colleague will put a link to the research and the policy brief in the chat. But it's also very interesting. We have all these examples of challenges and difficulties and problems, but there are really positive examples out there. So how do we kind of shift in that direction? So with that in mind, I'll go to one maybe second last question. But the question is, we know there is less funding for humanitarian aid globally. What role might your governments take to fill the gap? For example, can they allocate more national budget and take a greater lead in responding to humanitarian crises in your countries? I hand over to any of you. Yes, Rud. And governments, yes.
Yeah. So basically, when discussing with donors about specifying a little bit of the budget of each, program implemented by local partners, let's say, for example, capacity building for local authorities, government, and enhancing their monitoring systems to help them monitor the implementation process alongside the local implementer. They usually refer to a statement saying that the government has its own funding and it has its own development programs, and we cannot support, government within this humanitarian funds channels. And you, as local partners, cannot include those government representatives within, within your program. So basically, I'm referring to that no transparency means that nothing will be implemented on the ground, and you cannot witness, monitor, be proud of what is already on the ground by those governments. So basically, specifying funds for them along with no transparency and open doors and tables with all the active partners or active actors on the ground is leading to a gap, a very huge gap between the authorities, the government, and the humanitarian aid delivery channels represented by NGOs, etc. So what I am trying to say, not to confuse you, but yes, and in a context like Yemen, which is the political fragility is the key of all the issues in the country, we are looking forward to push them to handle their positions, to represent the country in a better way, to deliver the assistance, to be part of delivering, at least the emergency responses related to crisis, etc. We do that work. We try to push them forward to handle their role. However, I don't think donors is helping in this statement. They are not helping because they are not sharing information and have like open doors and tables for discussion and decision making to complement the humanitarian within the government responses. So it's basically it's the hope, it's the vision that we need to see in Yemen, but it's not implemented at the moment. And I think it is like it will take time to encourage those good people in the government to come back to where they were and start handling their work properly. Thank you.
Thanks, Claude. Maritza, maybe we could jump to you because it'd be very interesting to hear from the perspective of Colombia being a middle income country and the governance being much less contested than in Yemen and South Sudan as well. It'd be great to hear your perspectives. Thank you.
Bueno, alcaldes de Colombia decimos que en este
In Colombia,
sentido
in this sense, we say
se ha venido avanzando como en
that we
diferentes
have
procesos
moved
de
forward in different
coordinación, digámoslo
processes of
así. Ha
coordination.
ido cambiando a través de los
So
años,
coordination
como la
has changed
coordinación,
throughout the
la
years.
responsabilidad del gobierno.
The government's
Y
responsibility has
inicialmente,
changed.
pues, de pronto todo era muy confuso
Initially,
la manera de
everything was
cómo
quite confusing.
hacer una intervención cuando se
It was
presentan
confusing.
crisis.
They didn't know how
Pero
to
esto
intervene
fue
in times
cambiando
of
poco a
crisis.
poco.
But this changed over time.
Como en el 2017,
In
18 se crea
2017,
la unidad de gestión del
2018,
riesgo,
we created
que es
the Unit
una
for
unidad a
Managing
nivel de
Risk.
Colombia que canaliza
In
como
this
toda
unit, we
la parte de las
channel
situaciones de emergencia que se presentan.
emergency
Entonces, con
situations.
este espacio que se crea,
So in this new space
comienza a hacerse
that
un
was
poco
created,
más organizado
there
todavía
was a
en
bit
responder
more
a las afecciones
organization
cuando surgen las
regarding
emergencias.
immediate attention to emergencies.
Siempre ha habido como en lo que
However,
hemos
there has
observado,
always
hay
been
esa articulación que se trata de hacer
an
con la
articulation that
institucionalidad,
we
pero también
try
con
to
Naciones
carry out
Unidas,
with
con
institutions,
organizaciones
but also with the
internacionales en
UN, with
determinadas
international
regiones. Se
organizations in
trata de
different
hacerse
regions. We try to
esa complementariedad, lógicamente que siempre los
complement
gobiernos son los
efforts.
primeros que tienen que ser los
Obviously,
respondientes a
governments
cualquier situación
should
y
respond first
posteriormente
to any
entran
situation,
las otras organizaciones
and
a hacer
then
un
other
papel de apoyo
organizations
en
should
donde el
support
gobierno no
the
se
government
alcanza.
efforts if the
Pero aquí
government
también es
doesn't
importante
reach
tener
certain
en cuenta
areas.
que
However, it's
las
important to take
organizaciones
into account
locales
that local
siempre hemos
organizations
estado, así
have
sea para el
always
gobierno o para otras instancias de
been,
Naciones Unidas y demás,
whether for the government
al
or for
margen.
other
No han tenido,
agencies,
no se han tenido
they've
en
been
cuenta de que
on the
siempre hemos estado en
sidelines.
el territorio y nunca se han
Even though
tenido
we have
como
always
a
been
bien
within
involucrarlas
territories,
en los
we
procesos.
haven't
Entonces
been
siempre
involved
pensamos
in
en el de
processes
afuera, pero
immediately.
no los que
So
están en
we're
primera
also
línea.
thinking about,
Entonces es importante
we're
tener en
always
cuenta
thinking
que
about
siempre
the
las
external
comunidades,
agents,
las
but
organizaciones
not
han
the
estado ahí,
agents
no se han ido.
acting in the
Las
front
cosas van
line. So
transformándose,
our
las
organizations are
situaciones van
still there.
cambiando,
Situations
los
have
conflictos
changed,
se van
situations
acrecentando, las situaciones van
um,
aumentando,
vary,
pero la
there are more
comunidad sigue ahí,
conflicts,
la
but
gente sigue
communities
allí,
are
las
still there.
organizaciones
Their
colombianas. Entonces,
organizations are
no se ha
still
pensado
there.
siempre en que esas
So
grupos
we
o
don't
esas
always
personas
think
hay que
about
fortalecerlas. Por eso
strengthening the
decíamos, es
people, the
importante
local people.
ese
And this is
fortalecimiento.
why
Hemos
I was talking
hablado
about
de que
strengthening
las personas necesitan
local
cada día
efforts.
tener más elementos, más
Local people
capacidad
need more
fortalecida,
skills, more
aunque de alguna
capacities,
manera la tienen. Nosotros
although
decíamos, las
they
comunidades de
already
una
have
u
it
otra
in a
forma
way.
siempre
Communities
tienen una
will
manera de responder a
always
una
find a way to
situación,
respond to
de manera
situations,
empírica, sin
even if
estudio
it's
y
an
demás, pero
empirical
siempre hay una
way
respuesta.
or
Y eso a veces no
without
se toma en
any
cuenta,
external
porque
knowledge.
también hay un
And this
conocimiento
knowledge,
desde
this
lo local,
innate knowledge, let's
siempre
say,
lo hay.
isn't really
Entonces
taken
siempre
into account,
pensamos
even
que
though
el
it's
intra
always
pues es
there.
el que trae
So we
como la
always think that
solución
the external
inmediata.
partner
Siempre hay que
has the
tomar
solution, but that's
en
not always
cuenta quien
true.
está
We have to take into
en
account the
territorio para
people
ser
who are
complementado
in the
con
territory
las
and
otras situaciones,
complement
las otras
their
organizaciones, con
efforts
el mismo
with other
Estado. El
organizations or
Estado, ¿qué puede
even
hacer
by
en
the
este
state.
sentido?
So
Siempre
what can
tiene
the
que
state
estar
do?
apoyando la
The state
situación.
has to
Ellos permiten
support
que muchas cosas se den, pero
local
también otras
efforts
no se den. Lo que
because the
decíamos, a
state
veces
sometimes allows for
viene también
some
la
efforts
corrupción,
but not
que todo
others.
se
Of course,
presenta,
there's
hemos
always
tenido
corruption.
momentos donde los
We have all
recursos llegan
faced
o los hay,
moments
pero
where there are
son desviados
resources,
a
but
donde
the
no deben llegar
resources are
y
sent
realmente los recursos
to
no
places
llegan
where they're
donde
not needed,
se necesita para
and
la
they don't
atención
reach the
correspondiente.
places where they
Entonces, por
are
eso a
needed.
veces se ven abocados muchas
So
regiones a no
sometimes
haber una
there
respuesta
are
del Estado porque los
bottlenecks
recursos
in regions
se
because the
perdieron en
state
el camino
doesn't
y
answer
no hubo cómo
properly
llegar
because
a hacer una
resources are
respuesta
suddenly
real.
lost
Entonces, creo
and
que es
there is no
importante
real
tener en cuenta
response.
que
So we have
en
to
estos
keep in
procesos ha
mind
habido
that
transformaciones,
in
ha
these
habido
processes,
cambios
yes,
en la
there have been
medida en que el
transformations.
Estado no
The
respondía,
state
ahora trata de
did
hacerlo
not
mucho
always
mejor, trata de ser más
help, and
cercano a
now
las
it does.
comunidades, pero también
It
estamos en
tries
ese
to come
proceso de
closer
que
to
el
communities,
gobierno también
but
legitime a las
the government
organizaciones
also has to
locales y
legitimize
que se
local
apoyen en ellas
organizations.
y no
It has
siempre
to
esperar
provide
que
support
viene
to
El
them and
Salvador
not just wait for
o
the
las
external
organizaciones
savior
internacionales o
or
los
the
recursos de
international
X o Y,
organization
si las
or the
organizaciones,
resources
la gente
from
puede
this or
hacer
that
una
other
respuesta
donor,
más pronta y
because
cercana.
the people in the territory can have a more immediate response.
Thank you, Maritza. That was excellent, and bringing together a lot of different themes throughout this conversation. So we are nearly at the conclusion of the event. I maybe just wanted to give 30 seconds, 60 seconds to each panelist for a final concluding thought. Also, just to know, there will be a feedback form put into the chat. So please, if you can, we welcome your feedback, particularly if it's good feedback. If it's bad feedback, oh, maybe just keep that to yourself. So we'll get one final word from each of the panelists. Also want to say a huge thank you to the Dutch Ministry of Foreign Affairs, who is funding the humanitarian system transformation through local humanitarian leadership program, which is hosted with Oxfam. It is a very collaborative program operating across 7 different focus countries, but trying to push in many different ways for greater local humanitarian leadership. So thank you to Oxfam and the Dutch Ministry of Foreign Affairs for their support. But maybe just have, 30 to 60 seconds. Modi, I see your camera on. Please jump in with your final, powerful, concluding thoughts. Thank you. Oh, just need to unmute.
Sorry, my mic was mute. Thank you so much, Dustin, for the opportunity, and I would like to thank all our participants who have listened to us. In a special way, I would like to thank the organizers for this webinar. And then there's a lot to do. We have a lot to do in terms of responding to the humanitarian crisis. However, we really need support. We need backup. We need that funding that can enable us to move forward, to start responding locally to issues related to crisis and then humanitarian crisis in our community. We need support from the government, empower us so that we can take lead in whatever we are doing. Thank you.
Thanks, Modi. Claude, would you like to jump in with your concluding thoughts? Thanks.
Yes, thank you, Dustin. I was just trying to, write them down, but it's always good to be spontaneous about this. So basically, thanks to donors who really believe in the role of the local implementing partners and really believe in the importance of, supporting and strengthening their capacities and put them in the decision-making tables. So this is really appreciated. And I hope for more than this to be happening from other donors. And thanks to the Oxfam program, which basically is the hope for having like a strong system to shift or let's say transform the humanitarian assistance and the way the assistance is delivered to the community. So we believe that after this program, a 3-year program, we will be able at least to have like a work frame or something that can be disparate like globally, to be an example to for donors to be supporting localization, since we are now ending our 10 years of the grand bargain with no impactful results and indicators achieved, but still there is a hope, and I believe that we need to enhance the way of responding through those fund channels, especially now with the fund cuts. We need to decide better, and we need to focus on and prioritize those responding mechanisms and programs, and to be more innovative in those insights, and to think properly and get out of the box, and get assistance from whomever interested to support with exchange knowledge between countries, etc., just to make sure that those funds are creating real sustainability and resilience for the communities. Thank you, Dustin, for this opportunity. Thank you all.
Thanks, Maud. Maritza, final words. Thank you.
Bueno, de todas maneras, creo que dejar como
Yes,
algo
I want to
es importante tener en cuenta,
say
y
something
es
very
como que la
important to me,
localización no
which
es
is
una
that
moda,
localization is not a
exigencia
trend.
ética.
It's an ethical
El
necessity.
liderazgo local no puede seguir
Local
siendo
leadership
decorativo, debe
cannot
ser
be just
y
an
debe estar en
ornament.
el centro.
It has to be at the center
que
of
tenemos que
things.
pensar que el financiamiento directo, flexible y
Direct
sostenible
financing,
no es
flexible
opcional,
financing,
es
and sustainable
estructural para el
financing is
cambio.
not optional. It's
Y es
structural for
importante que los
change.
donantes no solo
It's important
sean
for
financiadores, sino que
donors
puedan
not
ser
only to
aliados
be
políticos en la
to finance, but
redistribución del
also to be
poder
political
humanitario.
allies in
Y que no
restructuring
solo basta
humanitarian
escuchar,
power. And we
sino
don't
que se
only
necesita
have to
ceder espacios
listen,
y tener
but we have to
confianza
allow for spaces,
y
and
los
we have to have
recursos para que las
confidence, and we have
cosas
to
también se
trust
transformen. Que este
that
proceso que
resources
estamos
can
llevando
actually
desde las
transform.
organizaciones
This
locales de base
process,
siempre
carried out by
es
grassroots
un camino
organizations and
en
local
donde hemos
organizations,
iniciado y que
is a
estamos
path that we have begun,
fortaleciéndonos de
and we
alguna
are
manera con
strengthening
el tiempo.
ourselves
Y ese acompañamiento
continuously.
es importante,
So we need
que
support.
tampoco es decir que nos dejen solos,
This
pero sí
doesn't
que
mean
caminemos
that we should
juntos
be left
para que
alone,
las cosas
but we
vayan
should go
cambiando. Y esto
together
es un
so
aprendizaje
that things
de
can
todos.
actually
Podemos
change. This is a learning experience
dando
for
de a
everybody,
poquito, pero
and
también
we
de
have to give
avanzando
from
a escalas
ourselves
agigantadas.
slowly, but we have
Queremos
to
agradecer el
march
espacio,
steadily.
gracias a Oxfam
So
por
thank you,
esta
Dustin.
oportunidad que
Thank
nos
you,
da
Oxfam, for
a
this opportunity,
diferentes regiones, lugares,
this opportunity for
compartir
different
nuestras
regions, for different
experiencias desde
places.
lo mucho,
Thank you for
desde lo
letting us
poco
share our
y
experiences, whether
desde
they are
cada día
big or
logremos
small.
mejorar
And I
y
hope that we can
lograr
improve with each
afianzar
day,
este
that we
proceso
can
donde
become
estamos
stronger
y que
in our
seguramente
processes.
todos vamos a
And
seguir
I hope
avanzando
that we
fuertemente
will all move
para el
forward
cambio en
to
este
create a
proceso
change in
humanitario.
this humanitarian process.
Thank you, Maritza. And yeah, a final thank you to all the panelists who have just been wonderful, and also the rest of the ODI and HBG team who have supported behind the scenes extensively, and to all the interpretation services as well who have been brilliant. So that is a wrap for today. And just we know that the scale of challenges is immense at the moment when we look across different contexts, the severe reduction in funding, but we really don't have the luxury to just step back from the crises we're facing. So it really is an all hands on deck situation. And we hope this has been useful insight in trying to flip the script on how we think about changing and improving the humanitarian system. And we hope we can all take this forward and really kind of push for a more locally led, transformative humanitarian system. Thank you all for taking the time, and please engage with HPG and ODI's work in the future, and we look forward to further discussions. Thank you again. Bye, everyone.